So, hello everyone, good evening. So, dear third year students, very shortly, in few days, you are going to have examinations. So, you are almost just like one month away, I think, 32, 35 or 40 days maximum, that you know better than me. So, you are at the very threshold of your examinations. So, you have got three subjects in third year, that is general medicine, general surgery, and then you have got oral pathology. So in every college, oral pathology is a subject which goes very well, perfectly training is there. But the problem lies with general medicine and general surgery. So you should be covering entire medicine and surgery perfectly in this next 1 month, tension free, so that when you go for your examinations or your study leave, you should be in a very comfortable position. So today I will be discussing few main questions, few short essays, few short answers. Okay. And I'll be telling you the study techniques, how you should do, how you should go for it, and how you should plan the next 50 days. So, are you with me? Yes. So, let's begin. So, today I have brought some 10 questions, the most important 10 questions, which I feel which is there in your question banks and which is there in your syllabus that should be discussed with you at any cost. Those topics I have brought today. So first and foremost, you should know your syllabus. So your general surgery, it starts with wound healing, and then you have got some important topics like towards the end you have got that is your fractures. The fracture is very important. You should know about in and out about fractures. Then your thyroid gland chapter, which in every college they teach in length and breadth. The thyroid you should know perfectly. And then there are a lot of topics like gas gangrene, tetanus, which are all main questions. Okay, so almost like some 17 topics are there. You will be reading different textbooks, different authors. So whichever authors, it doesn't matter. The answer you should know, that is important. So one thing is follow the textbook, whatever you are reading. Second thing is you should have the question banks with you, a perfectly collected questions of entire chapter wise, topic wise, we should have the question bank. So with that, let's start. So today I'll be doing a lot of questions. So first question is the topic number one. What we're going to start today is ulcers. So basically, ulcer is the main question. Okay, so it comes as a main question, and if it comes as a main question, it's a jackpot. So it's a very easy question also. So basically, what you are supposed to write. So first is definition, the classification of ulcers, and the clinical significance. In which conditions, when the patient is suffering, what type of ulcers are subject to happen, and what is the edge, what is the floor, what is the base, and the management of ulcer. So whenever you're writing an answer, please understand that you should write in a question, the breakup will be there. Define ulcer, classify, discuss in detail, any XYZ diabetic ulcer, something like that. So the whole question is divided into 3 or 4 parts. Each part carries a significant marks. So if you are writing all story without covering those points, you will not be getting any marks. So in order to get the marks, you need to answer to the point first. You should write all the answers pertaining to what is asked. Okay, so let's begin. Ulcers, the definition of ulcer, as you know, it's a break in the continuity. So there is a skin, suddenly there is a break, and the break in the continuity covering the epithelium. So the break could be not only epithelium, it could be break in the skin, in the mucous membrane, and because of which there will be the molecular death. As you see in the diagram, there is a dip over here. The continuity is broken and the loss of cells are here, the death of cells are there. So whenever there is an ulcer, it has got 3 parts. So this part, which is coming from the epithelium and going down, this is called edge. And then you have got the floor, which is the basement. And then you have got the base. So 3 parts which you should know. So each part has a relevance. So parts of an ulcer, margin, edge, and the base. Now this margin can be regular, irregular, round, oval, 4 different types, and each type of margin signifies different conditions. Those are there in your textbooks. You should learn that also, and that will be a Viva based answers also. Then you have got edge. So edge is the one which connects the floor towards the margin. So it's a connector, which you can see in the diagram. So edge is above the turning point and the floor is here. So then the edge is the connecting point between the margin and the floor of the ulcer. So this edge can be either straight, slope, crossway, anything it can be. So it could be sloping, undermined, punched out, raised, everted. Different types are there, and each type will signify certain conditions. That is the clinical significance which you are supposed to know and which you are supposed to write. Then the base, which is there at the bottom, is the one in which the ulcer rests. It may be bone or soft tissue also. So that is the difference. You should draw a neat diagram, and then you should tell the parts of an ulcer and each part different types and what does it signify. Then coming to the classification of ulcers, you have got clinical classification and pathological classification. Under clinical classification, again you have got spreading ulcer, healing ulcer, and callus ulcer. Different types are there. Pathological means because of some particular disease. Some disease is there inside. So it could be a specific ulcer, which may be tuberculosis or syphilitic. Tuberculosis ulcer means the patient is having TB. Primarily, the problem is TB, tuberculosis, because of which the ulcer is developing. Similarly, syphilitic ulcer, the patient is having syphilis, and then an ulcer develops, so that becomes syphilitic ulcer. So it's a specific one disease is there, and it's a pathology. And then actinomycosis and Melanese ulcer, so different specific ulcers. Then malignant ulcers, which can transform, and eventually you'll have to amputate the organ or the part also. That is carcinomatous ulcer, rodent ulcer, or melanotic ulcers. Then you've got a list of non-specific ulcers also. So basically clinical, pathological. So this is the classification which you should know. So some of the relevant or the more importantly asked ulcers in the exam is the diabetic ulcer. So as the name itself tells, diabetes. So due to prolonged duration of diabetes, there could be ulcers in the leg, feet and all. Right. So that's why diabetic patients, they are advised with a specialized slippers. Okay, where it is not the traditional slippers and shoes what we get in the market. It's a specialized one. So a lot of protection is given so that the ulcers are not developing or the pressure is not there. So this is because of prolonged or uncontrolled blood sugar levels, and diabetic patients are highly prone for foot problems, which I have just told you. So there could be diabetic neuropathy and peripheral vascular disease. So the nerve sensations may be lost. The patient does not know there is an injury or something is hurt and ulcer has developed. Patient may not be taking care also because he's not aware there is a problem. That is a neuropathy problem. And then as a result, the skin will break and then expose the underlying area. So skin breaks, all the subcutaneous layer, it gets exposed, gets infected. So basically, it occurs on the plantar aspect. It is the most common site, plantar aspect, and it also occurs in leg, upper limb, scrotum, and perineum. So these are the pressure areas where the patient will contact. Those areas, bottom of the toes, pad of the foot, heel of the foot. So these are the areas where injury can happen and it can develop into ulcer. So basically, it's a diabetic ulcer. So everything related to diabetes, you can write there is increased glucose precipitation. Glucose concentration is more and gets accumulated there. These are the causes. There is diabetic microangiopathy. There is increased glycosylated hemoglobin. So that hemoglobin levels are extremely high, glycosylated. Then increased glycosylated tissue protein, decrease the oxygen dissociation, and neuropathy is there, and atherosclerosis is also there. So these are basically diabetic related. So because of which ulcer gets an opportunity to develop. So what are the investigations you need to do? So student, you should know how to present an answer. So you started with the definition, then you went with the classification, then diabetic ulcer. If you are going, then what is diabetic ulcer? The causes, investigation, management. So investigation, because it's a diabetic, so blood sugar testing, random and fasting should be there. Urine ketone bodies analysis should be done, and if there's a discharge, culture and sensitivity test should be done. X-ray of the part wherever we should know that whether the bone is involved or not, and even arterial Doppler of the limb can be also done. So the treatment of diabetic ulcer, first of all, that diabetes has to be controlled. That is control of diabetes using insulin and antibiotics. If there's a wound, a proper wound care has to be done. Nutritional supplements, regular dressing, right? And then, if required, abscess drainage. And if it's still not under control, then the amputation of the toes has to be done. And eventually the leg also, if it is not controlled. And if soft tissues are removed, grafts can be given. So that was all about your diabetic ulcer. Next is Melanese ulcer, trophic ulcer, neurogenic ulcer. So different types of ulcers. Basically, the question will go in one pattern. Whichever is asked, you will write. But the definition, pathology, the management all follows the same protocol or prototype. So Melanese ulcer, it is an infection at an operative site. It appears 1 to 2 weeks after surgery. So a surgery is done, healing does not take place, and at the time, at the site of surgery, this ulcers develop. Trophic ulcers is because of prolonged pressure flow of blood of the skin, it stops, and this causes hypoxia, necrosis, and ulceration. So a long-standing people whose job is like that, prolong their standing or blood supply is less in that particular area. Neurogenic ulcer because of neuropathy, right? So loss of nerve function is there. As a result, the sensations are lost, and they will not have any pain or injury, or they don't know whether their leg is hit somewhere. As a result, the ulcer develops. So these are the basic ulcers you should read. Go back and read a little more in this. This is not sufficient, but this is almost 80 to 90% I have covered. So a beautiful diagram of ulcer has to be drawn, the prototype, where edge, margin, base, and different types you should write, and what does it signify, that also you should write. So that was our question number 1. So coming to the next question is acid-base balance. So it is an extremely important question. It comes as a main question also. Generally, this chapter is never touched. But if it comes, suddenly it becomes a main question. And most of the students don't study this question because it's little complicated. So I'm going to teach you in a very simple way. Out of textbooks, I'm going to explain you. Please pay little concentration and understand. And then you can go back and read your textbook. You will understand in a better way. So first and foremost, we are going to talk about acid-base balance. So in your 6th standard or 7th standard, you have studied the pH scale. 0 to 14. 7 is the neutral. So anything below 7, that is 6.5, 6, 5, 4, 3, 2, 1. 0 to 7 is acidic. 7 to 14 is basic. This is the full what you have studied. Same thing I have written. So in pH scale, the neutral pH is 7.0. Anything above 7, 7.189, that is basic in nature, or it is called as alkalosis. This word you should understand. Basic in nature or alkalosis. This is the neutral. So anything more is alkalosis, and anything less than 7, 6.9, 6, 5.4, anything you call it, anything below 7 is acidic. So this is one funda which we know in our schools. Now we are going to build on this knowledge. And one more thing what we have studied in our schools is, what is pH? The equation of pH is equal to minus log of 1 by H plus. So pH equal to minus log of 1 by H plus. So that means pH is inversely proportional to hydrogen ions. If pH is increasing, hydrogen ion is decreasing. That is inversely proportional. If pH is decreasing, hydrogen ion is increasing. So that is the one formula what you should know. So when I am telling pH is increasing, so increasing more than 7. So that means when it is basic in nature or alkalosis, hydrogen ion is decreasing. And when the pH is decreasing, that is becoming more acidic, hydrogen ion increases. This is the school knowledge what I told you. So one is pH scale, and the second one you have to know equation number 1. pH is equal to minus log of 1 by H plus, and it is inversely proportional. So I think till here you are okay with it. Now let's build on this. Now you have to learn one equation called Henderson-Hasselbalch equation, which you have studied in biochemistry in first year also. This is the equation number 2. So what is this equation? pH is equal to pK, which is constant, plus log base divided by acid. Base is numerator and acid is denominator. pH equals to pK plus log of base divided by acid. So by seeing this equation, what do you learn? This is equation number 2. Equation number 1 was before. pH is equal to minus log of 1 by H plus. That is equation number 1. This what you are seeing on the screen is equation number 2. So by seeing this equation, pH is directly proportional to base and pH is inversely proportional to acid. So that is very clear based on this equation. So based on this equation, pH is directly proportional to base. So if pH is increasing, the base is also increasing. pH is increasing, base is increasing. If pH is decreasing, base is decreasing. I am talking only in terms of base. What is that base? What is that acid? We will study in few seconds. So right now, just understand pH is directly proportional to base. If pH goes high, base also goes high. pH goes less, base also comes less. So that is equation, what observation you have to do. Again, observing this equation, pH is inversely proportional to acid. This is divided by, okay, numerator divided by denominator. So acid is a denominator. So pH is inversely proportional to acid. So that means if pH is increasing, acid is decreasing, inversely proportional. Otherwise, if pH is decreasing, acid is increasing. Okay, so this equation you should learn, which you should not miss it out. So this class is there in YouTube also. You can rewind, see again and again what I am talking. So based on this observations, pH is directly proportional to base, pH is inversely proportional to acid. That is very clear. And we have understood that if pH increases, that means base increases, that is alkalosis. pH decreases, that means it's going towards acidosis. So that funda is very clear. So now the third step. First one was our school, what we studied, we studied. Second is this slide. Now I am going to the third part of this question. And that is, what is base and what is acid? Base is bicarbonate, that is HCO3 minus, and acid is PCO2. Simple. Now put it in that equation. pH is equal to pK plus log base divided by acid. So base is HCO3 minus, acid is PCO2. Now two terms will come. This is the introduction of the third segment in this question. Two terms, metabolic, respiratory. Now please understand, metabolic means your reactions are happening in your body, anabolism, catabolism, all those things are happening. So basically it deals with bicarbonate, HCO3. So whenever I am telling metabolic, please understand it deals with HCO3, and HCO3 is the base, bicarbonate is the base. And PCO2, CO2 means carbon dioxide. So oxygen, carbon dioxide for what? Respiratory system. So whenever I am talking about respiratory, it is PCO2, carbon dioxide, and that is acid. That you have to correlate. This is like a mnemonic I am giving you. So whenever I am telling metabolic, you will talk in terms of base. Acid remains constant. And whenever I am talking about respiratory, you will talk about CO2, and that is acid. The base remains constant here. In either way, the other one becomes constant. Am I clear? Right. So now let's start. Now metabolic, respiratory. Now in each metabolic, two terms will come. In respiratory, two terms will come. Now let us talk about metabolic. Metabolic means bicarbonate, what you are seeing here. So based on this equation, metabolic means base. In metabolic, acid is constant, and in respiratory, base is constant. So let us forget acid. In metabolic conditions, acid is not required. Let us discuss only about the base. Now, when I am telling pH increases, that is alkalosis or basic in nature. So if pH, now we are putting metabolic in front of that. So when the pH increases, it is alkalosis. So metabolic alkalosis, alkalosis means pH increasing. So bicarbonate also increases. So in metabolic alkalosis, pH increases, base also increases. Am I clear? Then let us discuss about decrease. If in metabolic acidosis, pH decreases, the base bicarbonate also decreases. That is your conditions. And when pH increases, it is inversely proportional to hydrogen ion, our first equation. That also you can mention over here. So in metabolic alkalosis, bicarbonate ion increases. Metabolic acidosis, bicarbonate ion decreases. Now let us talk in terms of respiratory. So respiratory means CO2. CO2 is acid. So we will discuss about acid. So here base becomes constant. 1, you can call it. So pH is inversely proportional to acid. Now talk about respiratory. Respiratory alkalosis. So pH is increasing. Alkalosis. Respiratory. So in respiratory, we talk about CO2, and CO2 is acid, and it is inversely proportional. So in respiratory alkalosis, if the pH is increasing, the acid part, that is by PCO2, is decreasing. Whereas the other way, in respiratory acidosis, pH is decreasing, PCO2 is increasing. So it's opposite actually. Okay. So this is what metabolic alkalosis, metabolic acidosis, respiratory alkalosis, respiratory acidosis. So basically it is, one mnemonic is there, ROME, R-O-M-E. In respiratory it is opposite, in metabolic it is equal. Very simple. In respiratory, pH is inversely proportional to acid, inversely, so it is opposite. Whereas in metabolic, it is direct, pH is directly proportional to base, so it is equal. If both pH increases, base also increases. pH decreases, base also decreases. So I hope you got a concept. If not, replay this and learn again and again. And everything is put into this slide. The only thing is the definition you have to write and 2 causes and some reasons regarding this. The whole structure of the acid-base balance concept. This can be a 3 marks question also, either a main question or a 3 marks question. So you need to learn this question perfectly. This was the most toughest part. I explained that. Other things, it's very easy in the textbook. You can read yourself. Okay, so coming to next question, question number 3. This is nothing but wound healing. Okay, so wound healing is again the main chapter. So different textbooks, different ways of explanations are there. So whenever there is the definition, classification of the wound, and then the healing process, primary intention, secondary intention. Basically, difference between primary intention and secondary intentions are asked in the exams. That you should know perfectly. So first and foremost, there will be an inflammatory state. Then after the inflammatory stage, there will be granulation formation. Then organization, stage of epithelialization. Then the wound will contract, scar formation will be there, and maturation will be there, or remodeling you can call it. So these are the steps or procedures in the wound healing. So different steps or stages have different time frame. So inflammatory stage will be for 3 to 4 days. So here the clot formation will be taking place, and then your MMPs, matrix metalloprotease enzymes, they come into the site, and macrophages, blood cells will come, they will utilize the bacteria. So basically the inflammation is taking place here, and then macrophages will secrete the growth factors and cytokines, which will stimulate fibroblast proliferation. Then the next stage is after 4 days, it goes up to 14 days, 2 weeks to 6 weeks. That's the proliferative phase, where new blood vessels, whatever deficient area was there, it got cut because granulation tissue is formed. Again, the regrowth takes place. New blood vessels start, fibroblast produces collagen. So collagen are type 1, type 2, type 3, type 4. Okay, type 1 is in bone. Sorry, type 1 bone. Type 2 is in cartilage. I'm talking about collagen. Type 3 is in the principal fibers, and type 4 on the basement membrane and all, right? So then up to 18 months or up to the wound closure, the scar formation will be there, and collagen in the wound will mature and it will strengthen. That area becomes little hard and rough also. So this is the diagram which you should know. Hemostasis, the first phase where there is a cut or injury. Then this is the first phase, inflammation, proliferation, remodeling. So same wound, you see step by step how it has regressed and the healing took place. So factors affecting wound healing, this is a part of the main question. Local factors and the general or systemic factors. The local factors pertaining to the local area, if any foreign body is there, healing will be hampered. If infection, ischemia, neoplasia, so locally that area some problem is there, healing will not take place. The general factor is the patient's body is not supporting. If there is diabetes or aging problem, patient is on steroids. So these are the congenital problems like Ehlers-Danlos syndrome. There also healing is affected. So this local general you should learn in detail. And then the contraction of the wound, you should know how much time it takes and how much at what rate it contracts. So basically, we have done 3 questions today. Till now, ulcer, it's a main question. Wound healing is again a main question. And then the second question what we did was acid-base balance, which is extremely important. Acid-base balance can come as a 3 marks question, short answer, or a main question, short notes also they can ask. Next question, very important question, gas gangrene. Gas gangrene and tetanus are the extremely important topics which you should know, and it's a very easy topic, but people don't study because the length, it's easy but it is very long topic and they forget what to write in the exam. So this is the contents what you should write in the exam, starting from definition, etiology, predisposing factors, and then what you call it, your just a second. Yeah, starting with etiology, with predisposing factors, basically types of gangrenes. Okay, there are different types of gangrene which you should know. That is dry gangrene, wet gangrene, that you should know. And the toxins what are liberated, which organisms are responsible, what are the toxins, and why gangrene happens. So this is basically a pathology question. So the clinical features, diagnosis, treatment, then the prophylaxis, very, very important. Then what is the surgery, treatment. So this is the format in which you have to write. So let's quickly go into this. So first and foremost, it's a repeated question. Please understand that even if you have not studied throughout the year, just learn now, it's more than enough. So what is the gangrene? It's an infected gangrene, gas gangrene. So here some gas is there, bad smell is there. So the bad smell gangrene or gas gangrene is an infected gangrene caused by an organism called as clostridial organism. And basically it involves skeletal muscles, and it will be, swelling will be there. So it will be an edematous Myonecrosis, necrosis of the muscles. Myonecrosis. So infective gangrene caused by clostridial organism affecting skeletal muscles and edematous myonecrosis. So earlier it was known as malignant edema also. So why it happens? Some sources because of contaminated, manured or cultivated soil and intestine. Someone falls down in the soil and their bacteria are there, an injury, the cut is there. So with the opening, this bacteria goes inside. So clostridial organisms in fecal flora can infect wounds. If already pre-existing wound is there, it gets contaminated with the soil, manures, then also problems can happen. Especially in the presence of calcium from the blood clot of silica from the soil. In your blood, calcium is there. In the soil, silica is there. When they mix, it gives a very good environment for this clostridial organisms to cultivate and grow. So basically accidents. So crush wounds, road traffic accidents, right? Amputations. This all areas, if not proper care is taken, it can lead to gas gangrene. Basically trauma and anaerobic environments in wounds allow aerobic organisms to consume oxygen, creating conditions for clostridial sepsis. So it should be whenever the wound is there, a proper aeration should be there. If the anaerobic environment is created, then it gets a chance for the organisms to grow. So which are these clostridial organisms? There are 4-5 organisms. The most important one is Clostridium melki, which accounts for 60% of the causative reasons. Then Clostridium edematans, septicum, histolyticum, all these things are there and everyone has A, B, C, D, E strain. So A strain is the most important or the most common which causes causative or reasons. So basically when a patient falls down, he falls down on the soil and then injury is there. Spores enter through the devitalized tissue, the tissue which gets cut. So from that spores of that clostridium which was growing in the soil, manure or anywhere, that goes inside. And then the spores goes inside and they germinate. They release bacteria in the blood and they multiply. And these exotoxins are released. So once it enters the body, the exotoxins are released. So these exotoxins, what are those exotoxins? Lecithinase, hemolysin, hyaluronidase, proteinase. And the functions of each it is written here. Just go through it, you will learn everything. Lecithinase is hemolytic, it will break the blood components. Hemolysin, again same thing. Hyaluronidase, it will help in rapid spread. Around the tissue planes, it will spread. And proteinase enzyme will break the protein. So these are all destructive in nature. These exotoxins which are released into the body. And then over a period of time, muscle necrosis and gas production will start. Because it's a bacteria, they're doing surgery, they are doing their operations, so gas is liberated. Bad smell. What is that gas? Hydrogen sulfide. Second one, nitrogen. Third is carbon dioxide. So these 3 gases, it's a Viva question. So these gases are released, then it will turn the muscles into brown color or black color, and that area needs amputation. So liver also gets involved, and then it will lead to necrosis. Then rapidly spreading, and or it will spread and fatal it can become. The patient can even die also because of this. So these are the reasons what you should know. So this muscle which is there, the glycogen breaks down, and then lactic acid, carbon dioxide, and then hydrogens are released. And as I just told you, proteinase enzymes are there. So it will break down the amino acids, ammonia, hydrogen sulfide. So all those things are released. So very foul smelling, bad smelling it will be. So once this clostridial organism enters, it have an incubation period. So this comes under clinical features. So incubation period is 1 to 2 days. Then after that, a slight fever will come to the patient. Fever, toxemia, tachycardia, and the fever will increase. Then the wound is under tension. Whichever part got affected is under tension, and foul smell comes. Like very rotten smell comes. And that area will become brown or black in color. crepitus can be seen. Gas is there. A little tick sounds you can crepitus you can see. And because the enzymes, exotoxins are there, they are breaking down the blood. So jaundice will be there, and which will lead to oliguria and even renal failure also. So small accident, he fell down, he did not take proper care. Bad luck, he fell on the soil which has the clostridial spores, and then all those things happen. That's why wound care is very, very important. Then it can happen, frequent sites are lower limb, buttocks, subscapular region, upper limb. So mostly anywhere internal organs, anything can be affected. So different types of gas gangrene. Fulminant type, it spreads very fast and the patient dies because of renal failure or liver failure. And then you have got massive type where the whole organ, the whole part is got involved. Whole of one limb or everything is getting involved. And the group type, the group of muscles also gets involved. Single muscle type, only one muscle, and subcutaneous type. So name itself suggests that what it is. So no need to worry about that. So complications of gas gangrene, septicemia, very, very dangerous situation. The whole body, cellulitis is there and septicemia is there. Toxemia, renal failure, liver failure, DIC. Basically, patient is in a very advanced stage, very serious stage, and in no time he will reach here. So that is why it is very important to have a proper diagnosis. First and foremost, X-ray of the part has to be taken. Liver function test, CT scan of that area has to be done. And the gram staining of that bacteria, Clostridium bacteria, gram staining you have to do to identify that. Then Robertson cooked meat media and Clostridium vaginae is grown in cultures containing 20% human serum in a plate. So that is what all the things you should know. Extremely important investigations. So then coming to the proper care of the gas gangrene, proper debridement, that area should be properly washed on a running water. All the soiled area, whatever foreign particles, it has to be taken out. And devitalized wound should not be sutured. So don't suture that part. Keep it open only. And if lot of foreign particles are there, mud is there, pour hydrogen peroxide and normal saline to clean the wound. And penicillin prophylactic antibiotic. So this is the care what the person should take when there is an injury, when they fall down. They just wash it and just forget it. This is the one what is required. So again, antibiotics, your penicillin 4th hourly, 8th hourly. So injection, benzyl penicillin, metronidazole, and if blood is going out, hemolysis is happening, then blood supplements, blood transfusion needs to be given. And then antiserum, polyvalent antiserum has to be given. Hyperbaric oxygen, which we give it for osteoradionecrosis. If the bone is getting involved, we give it for that, where the whole area is completely devitalized in osteomyelitis and osteoradionecrosis. So same hyperbaric oxygen therapy is given. So this is a hyperbaric oxygen chamber where the patient is sent inside. So a patient is given 100% oxygen. Normally 19 to 21% oxygen we breathe in. But here in this chamber, 100% oxygen. Atmospheric pressure right now what you and me are sitting is 1. So inside the chamber increased to 2.4. 100% oxygen, atmospheric pressure 2.4 for 90 minutes of time. So that is called 1 DIVE, DIVE. That is the unit of hyperbaric oxygen therapy. And then there is something called as Mark's protocol, which you will study later in your final year. That should be followed. So just basic information is very important. Then your supportive care, lot of fluid supplements, electrolyte management has to be given, and then whole blood transfusion and ventilator support if required has to be given. Then infection control, fumigate the ward because foul smell is there, and then it's all decontaminated, right? So all those things should be properly taken care of. The patient should be dehydrated, infection, toxemia, all the critical care has to be taken care. So supportive care, infection control, and critical care. So that is all about your gas gangrene. Right? So it's a main question. It's an elaborate question. You can write out and out. Next question, very important. Tetanus. Again, a main question. So again, you should have a structure how to write this question. You cannot write blindly. So definition, the bacteriology or the positive organism, incubation period, mode of entry, etiology, different types of tetanus, clinical features, treatment, prophylaxis, and the causes of death. Extremely important. This is how you should present an answer. So basically, tetanus, as you know, it is again Clostridium tetani, which leads to spasm of the muscles, muscle spasm, and patients will get epileptic attack. Fits will come, tonic-clonic convulsions, which it will lead to. So it's also called as lockjaw because it's a spasm. It is called as lockjaw. So all the information is here in this slide. The positive organism, Clostridium tetani. It is gram-positive. It is peritractus flagella is there. Spores, terminal spores are there. So this is basically a microbiology slide. Infective agent, spore is the one which is responsible. Habitat in soil, manure, dust. Very important. So that is why if you get hurt with a rusted nail or anything which is rusted, better to take a TT injection. Tetanus toxoid. This is the same tetanus I'm talking about. So mode of entry through wounds, prick injuries, anything prick. Road traffic accidents, penetrating injuries, foreign bodies, anything, something stuck you, nails or something, then you have to take the TT injection. So basically, suppose a nail is rusted and in that nail the spores are there and it goes inside, then the spores goes inside your body, enters the wound, and then it multiplies. Exotoxins are released, same like your gas gangrene. So here the exotoxins are tetanospasmin and tetanolysine. Spasmin means spasm, lysine means breakdown. That's the difference. So tetanolysine will lead to hemolysis, breakdown of RBCs and all. Tetanospasmin, it will attack the neural sheath, central nervous system, then it will block the neurotransmitter cholinesterase, causing hyperexcitability, and then there will be tonic-clonic convulsions. So I told you in the definition also, epilepsy is there. Whereas this tetanospasmin, it will go into circulation, blocks the neuromuscular junction, and activates or aggravates the muscle spasm. So there will be a rigid phase, locked phase, or locked body. Different types of the locking things are there, which I will be talking about right now. So signs and symptoms is which the patient tells: jaw stiffness, pain, and stiffness in the neck and muscle. So a lot of stiffness will be there in the body, not flexible. And the patient will bend also. Anxiousness, lot of sweating, headache, delirium, and sleeplessness will be there. Difficulty in eating also, and difficulty in breathing also. So basically, the classical sign is called rhizus sardonicus. This is the viva question, and this you should write in the exam. If a question on tetanus comes and if you have not written this, you will not get marks. So rhizus sardonicus is the smiling face. The patient face becomes something like this. It is not because the patient is smiling. It is because the muscles get locked. So it looks like the patient is smiling because of spasm of the muscles. And there is rigidity in the neck and spasm of all the muscles. Right? Hyperreflexia, respiratory changes will happen, and patient will have fits also, epileptic attack also. So severe convulsions can lead to again fractures. There will be vigorous movement, fractures can happen. So if an attack comes of epileptic, first and foremost, whatever is there inside the mouth, take it out. If possible, you put a bite block. That is not possible in the roadside or outside. Whatever handkerchief or some cloth you have, or the chunni what girls will have, keep it inside the mouth so that the teeth are not biting. The tongue is not getting injured. Otherwise, because of severe movements, the tongue may get injured. And then tilt the patient to one side, the froth which comes, it will drain out. So that is an immediate treatment, what we should know and give, and diazepam injection to calm the patient. So here there will be fever, tachycardia, retention of urine, all the muscles are getting spasm. Very dangerous situation. Then carditis, inflammation of the heart will happen. The incubation period is 7 to 10 days. So that means a patient spore went inside the body, he fell down somewhere. After 7 to 10 days, the signs and symptoms start developing. 1 week he will be fine. So it will affect on respiratory system. And then different postures. That is opisthostonus, orthotonus, emprostonus, and neurostonus. So these are all descriptions are there, which part of the body will bend, how it will bend, what it is. So this is all very important postures in tetanus. You should know about this. So then different types of tetanus from early, latent, late, ascending, descending, cephalic, different types, whichever part of the body is involved. The whole chart explains that. So you should learn all those things. Because in 1 hour time, it's not possible for me to cover everything, but I'm just giving you the guidance how you should go for it. Then staging of tetanus, there are 3 types: mild, moderate, or serious, and then dangerously mild, moderate, severe, or mild, serious, and dangerous. So mildly ill, rigidity, spasm, trespass can be there. Seriously ill, spasm, rigidity, and severe respiratory functions. And dangerously ill, cyanosis with respiratory failure and tonic-clonic convulsions will be there. Differential diagnosis, very important. The signs and symptoms may suggest you from strychnine poisoning also, or chemical. And then this must lead to other causes like dental, oral, tonsillar sepsis, or oral malignancy. Because of that also stiffness can happen. That is just a differential diagnosis, but the stiffness you can make it out very easily. Otherwise, these fits are there. That could be because of meningitis and hydrophobia also. And it could be a convulsive disorder also. So basically, the culture media for Clostridium tetani are Robertson cooked meat media and nutrient agar. This is very important Viva question, MCQ question, or you call it entrance exam point of view also. It's very important. So coming to the treatment of tetanus, so to take care of the patient in a dark, quiet room. Then the treatment is anti-tetanus globulin. You will give anti-tetanus serum. You will give wound. You will manage and supportive care. So you take a screenshot of this. You can read in details the dosage and all. So every section, every part of the patient you need to manage. And tetanus vaccination has to be given. So basically, anyone gets injured or nail goes inside the body or something, that day you will take a tetanus. And basically, first 24 hours you should take tetanus, preferably for 6 hours. But within first 24 hours, if you take, still okay. So whenever a nail you got a prick, blood came out, better to take a TT injection. So today you are taking, so that is 0. Then you will repeat the booster dose after 1 month, and then after 6 months. 0, 1, 6. Please remember this. This is a very important Viva question also. 0, 1, 6. And then you have got medication, diazepam to control the patient because tonic-clonic seizures are there. Phenobarbital, chlorpromazine, injection, penicillin injections, gentamicin and metronidazole so that the wound is taken care of. Supportive care and advanced respiratory support. Right. So this is how you have to write an answer. Otherwise, it will be difficult. Good nursing care, physiotherapy, steroid use, prevention of muscle spasm, all those things needs to be taken care of. Right. So we have discussed 5 questions, 5 to 6 questions now. So dear students, you are having exams in the month of January now. So hardly 35 days are left, or 40 days total. So you should have a good study plan. You should know how to study, what to study, how to make the best use of the day. So making best use of the day, you will understand only when you know what are the facts. So this is a study done on thousands of people, and this was the inference. The mind is super active from morning 4 a.m. to 9 a.m. That is the best time for on a study group. Then the second best time is evening 7 to 10. So basically, you should find out, you should observe yourself for 3 to 4 days, and then you should grade it. Morning, I studied at 8 o'clock, 10 o'clock, afternoon, night, whichever time you study, you rate it. Which is your best time? First best time, second best time, third best time. So in your best time, study the most difficult subject. And in your worst time, which you are not active, study the most easiest subject. That will help you to understand better and your grasping power will be high. Otherwise, whenever you are very active and you're reading the easy subject, okay, only one subject you may do it well, but other subjects you will not be doing well. It's extremely important to use this mechanism. Okay, so next question. Hashimoto's thyroiditis. So it's a short answer, 3 marks question. So basically, it is also known as diffuse non-goitrous thyroiditis. Other name for this. So it's an autoimmune thyroiditis. It is the body itself. It's recognizing its own cells as foreign. So own body, body is understanding this is not mine, this is foreign, and creating an antibody against it. So there is a fighting going on against your own cells. So it's an autoimmune thyroiditis, and it is very common in women. So what happens? The thyroid gland, there is hyperplasia. It grows initially, and then it will lead to fibrosis, and then infiltration of plasma cells and lymphocytic cells will come into action. So that is the inflammation, how it proceeds. So in Hashimoto's thyroiditis, there is thyroid enlargement, which I have just now told you. Generally, one lobe or both the lobes, and the lobes may become firm, very hard, or it may be tender also, or smooth also, or one lobe may be affected. The symptoms may be it starts with toxic features and later show hypothyroid symptoms. Initially, it will be excitation followed by depression, and it could eventually hepatosplenomegaly also may be present in these patients. So other autoimmune diseases could be associated, and thyroid antibodies, there will be increased, significant rise in thyroid antibodies. That is why it is autoimmune. The cells of the thyroid body is making antibodies, so a reaction is happening. So malignant risk is also there, which can predispose to malignancy. So this is basic short answer which you should know. Investigation, you should do FNAC, T3, T4, all TSH, all the values of thyroid hormones you should check. And ESR will be very high because it's an inflammatory reaction, allergic reaction. So the ESR value will be very high, over 90 mm per hour. Generally, it is 0 to 20. So it is 90 mm per hour. So the treatment of Hashimoto's thyroiditis is L-thyroxine therapy, steroid therapy, and then subtotal thyroidectomy. If you want, you have to remove that gland also. So this is what you should be knowing this. Next question. Shock. The shock question you know very well. So from the heart, the blood is not pumped to the brain. So from the heart, the blood does not go into the brain properly, and there is a disruption, and the connection between the brain and the rest of the body is gone, and the patient collapses. The shock is a state of poor perfusion where there is circulatory failure, and as a result, the cells of the body all will get affected, and then severe pathophysiological abnormalities can come. The causes of shock could be n number of things. First is hypovolemic, less blood is being pumped to different organs of the body. So that could be hypovolemic shock. Why hypovolemic? Heart may be normal, but blood is not being pumped, or blood is not there. Why? There could be an injury in the hand, the blood is going out. So maybe because of hemorrhage, or severe burns, or intestinal obstruction, or vomiting and diarrhea, because of which the whole fluid loss is happening externally. So the blood is not pumped into the body. Or second one would be blood is there in your body, but the heart is not circulating it properly. That is cardiac causes. So the cardiac causes are acute myocardial infarction, acute carditis, pulmonary embolism, drug-induced toxemia, and it goes on. The explanation is there. You can take a screenshot of this. You need to write all those things. Then septic shock. So the septic shock is because of the bacteria inside the body. They release chemicals or exotoxins, and because of which it leads to shock. Neurogenic shock, it could be a sudden stimuli. The stimulus is there, the nerve gets excited and leads to vasodilation. Anaphylactic shock, it is an allergic reaction, hypersensitivity. Then respiratory causes and other causes. So there are 7 causes of shock. The description is there. So it's a beautiful table where everything is mentioned in the brief. You can take a screenshot of this and you can write this. So this is the pathophysiology of the shock. So any cause of the shock, whether it is hypovolemic or cardiogenic or any reason you call it, low cardiac output, vasoconstriction will happen. Then because of vasoconstriction, heart will beat faster, vasodilation, tachycardia will happen. Then the dynamic circulation increases, tachypnea will come, patient will beat more faster, and peripheral veins, again it will contract. As a result, urine concentration will become because from the blood only urine is made, right? So that is also getting affected and cardiac failure is also happening. So it's all interrelated. The effects of shock, every organ of the body will be affected. So the heart, lung, metabolic. This is very simple. Every part of the body will be affected. So each cell of the body will be affected, especially the brain organs. Decreased perfusion, so drowsiness, patient will feel drowsiness, and then kidney, blood, GIT, liver. So please understand that compared to all the organs, brain is the last one to get affected, because whenever there is a circulatory disturbance or less, the other organs, liver, lung, kidney, they know that if the less blood go to the brain, body will collapse. So they say, okay, fine, you give to brain, we will not take. So this compensation is happening. What kidney, liver, lungs, everything will tell to heart, okay, you give it to brain, but you give us less, no problem. So initially, the compensatory mechanism takes place. But after a period of time, when it is not able to manage that stress, blood goes less to the brain and then the shock happens. So this is how it happens. Okay, whatever may be the cause, there is less blood, so hypoxia is there. Then systemic inflammatory response syndrome develops, and it goes from reversible to irreversible state. From a reversible shock, it goes to irreversible shock. So in early stages, the clinical features are the patient may feel tachycardia, beating heart, the same reasons, whatever I explained, same thing is here. Sweating, cold, periphery, extremely cooling of the blood is not happening, right? So that is why. Hypotension, and next stage is cyanosis, jaundice, drowsiness. So basically for these patients, regular monitoring of blood pressure, heart rate, respiratory rate, all the lines should be checked properly, and urine output, extremely important. Urine output and serum electrolyte estimation needs to be done. Guidelines for the treatment of the shock: treat the cause, why it happened, you should know and treat it. Fluid replacement, extremely important. Crystalloids or colloids or the blood, you need to give it. And then inotropic agents, acid-base balance, you can give Darrow solution, Ringer lactate solution, whichever is required accordingly. Then steroids and antibiotics needs to be given. Same way, urine output monitoring, oxygen, CVP line, blood, brain perfusion, you need to check. Lot of blood should go to the brain. So position should be, the patient should be taught about position, the Trendelenburg position, so that heart is at the higher level and the brain is at the lesser level. So the blood flow to the brain is easy. These are the things what you should know. Okay. So dear students, Now you have got around 35-40 days. So please break down the whole general surgery into 3 parts. First part is the easy subject, easy topics, middle topics, the moderate difficult ones, and the severe topics, that is very hard topics, where your thyroid and your fracture comes. So you make a whole timetable, read one from each section. So 3 sections you have made: easy, moderate, and tough ones. So from each section, read one, and you should be able to finish the tough ones in 10 days, easy ones in 7 days, and the moderate ones, no, other way. The tough ones in 10 days, moderate ones in 7 days, and easy ones in 5 days. So basically 20 to 22 days, if you invest properly, 3 to 4 hours, you can finish your general surgery. After that, you can go for n number of revisions. So other aspects, how to do, what to do, we'll deal in our next session. Okay. So I have discussed 7 to 8 questions, which are extremely important. So please go through this, learn through this, how to write, and always remember the 3 hours is very important. You have to utilize all the 3 hours. Don't get up early. And your paper management, you get a booklet of 50 papers, you need to write that. And your time management of the questions also. 2 main questions, 4 short essays, 10 short answers. A beautiful time management has to be done. You can first write the short answers, then the short essays, and then the main questions. Okay. So in future, with other edition will come where we'll cover the other topics of general surgery. That's all for today. Okay then. Thank you. Thank you so much.